If you are over 60, I need you to watch this video carefully, because what I am about to share with you is something most people only learn about after it is too late. A stroke does not always arrive without warning. In the weeks before a major stroke, the body sends signals. Small ones, easy ones to dismiss. And I have sat with too many patients who told me afterward, "I noticed that. I just thought it was stress. I thought it was nothing." Today, I am going to make sure you never say those words. I want to start by telling you something that most people do not know. Before a major stroke, many patients experience what we call a TIA, a transient ischemic attack. Some people call it a mini stroke. I prefer to call it a final warning. A TIA happens when blood flow to part of the brain is briefly interrupted, for minutes, sometimes less. The symptoms can come and go so quickly that the person dismisses them entirely. But here is what the research tells us. Up to 15% of all major strokes are preceded by a TIA within the previous 7 days. And the 48 hours following a TI carry the highest risk of a full stroke. Which means, if you recognize what I am about to describe and you act on it, you may have a window to prevent the worst from happening. Let me walk you through the warning signs. I am going to be specific and clear because I want you to be able to recognize these in yourself or in someone you love. The first warning sign is sudden, brief vision changes. Not a gradual change like needing new glasses. I am talking about a sudden loss of vision in one eye. Some patients describe it as a curtain being pulled across their sight that lasts for seconds or a minute and then resolves completely. Or double vision that appears out of nowhere and disappears just as fast. Because it resolves, people assume it was nothing. It was not nothing. The visual cortex and the optic nerve are highly sensitive to disruptions in blood flow. This kind of brief vision disturbance is one of the most reliable early warning signs of cerebrovascular trouble. The second warning sign is a sudden episode of weakness or numbness on one side of the body. One arm feels heavy. One leg briefly gives way. One side of the face feels strange, not painful, just numb or slack for a moment. Again, it passes. The person shakes it off. But one-sided weakness or numbness, even briefly, even once, is a neurological red flag. The brain controls the body in a crossed pattern. The left brain controls the right side of the body and vice versa. When one side of the body is affected, it tells us one specific hemisphere of the brain is under stress. The third warning sign is a sudden severe headache with no clear cause. Not a regular tension headache that builds over the day. I mean a headache that arrives suddenly and feels unlike any headache you have had before. Patients often describe it as the worst headache of their life. This type of headache, what we call a thunderclap headache, can indicate bleeding or sudden pressure changes in the blood vessels supplying the brain. If you or someone near you experiences this, do not wait. This is an emergency. The fourth warning sign is sudden confusion or difficulty with words. A moment where the right word simply will not come. Not just occasionally forgetting a name, which is normal, but a sudden inability to form a sentence, to understand what someone is saying, or to express a thought that was there a second ago. It lasts 30 seconds, or a minute. Then it passes. People laugh it off. They say they are tired. But sudden language disruption, even briefly, indicates that the language centers of the brain, located in a very specific region, are not receiving adequate blood flow. The fifth warning sign is sudden loss of balance or coordination, not dizziness from standing up too fast. I am talking about a sudden feeling that the room is tilting, that your legs are not responding the way they should, and that you nearly fell for no clear reason. The cerebellum, the part of the brain responsible for coordination and balance, is extremely sensitive to changes in blood flow. A brief episode of severe balance disruption is not something to dismiss as clumsiness. The sixth warning sign is unusual fatigue combined with any of the above. Many patients in the weeks before a stroke describe a profound exhaustion that feels different from normal tiredness, not just sleepy, deeply, heavily tired in a way that rest does not fully fix. On its own, fatigue means many things, but fatigue alongside any of these other signs, even mild versions of them, changes everything. Now, let me tell you what to do. If you experience any of these symptoms, even briefly, even if they resolve completely, I want you to do one thing. Go to an emergency room or call emergency services the same day. Do not wait to see if it happens again. Do not call your GP in the morning. The window for intervention after a TIA is narrow, and acting within 24 hours can dramatically reduce the risk of a major stroke following it. At the hospital, ask specifically for a stroke assessment. Tell them exactly what you experienced and when. Be specific about the duration and which side of the body was affected. For prevention going forward, there are 4 things with the strongest evidence. Keep your blood pressure below 130/80. High blood pressure is the single most significant modifiable risk factor for stroke. Know your atrial fibrillation status. AF causes blood clots that can travel to the brain, and many people over 60 have it without knowing. Manage your blood sugar. Diabetes doubles stroke risk. And take a daily walk. 30 minutes of moderate walking reduces stroke risk by up to 27% in people over 55. I want to close by saying something directly. If you watched this video and recognized any of these signs, in yourself, recently, even mildly, please do not scroll past this. Please act on it today. Not because I want you to be afraid, but because a stroke is one of the most preventable major medical events there is, if the warning is caught in time. You now know what the warning looks like. Use that knowledge. Share this video with the people over 60 in your life, because the person who needs this most is probably not looking for it right now, but you can send it to them.